Hello, everyone. We'll be getting started in just a moment. Welcome. All right. Welcome, everyone, to Services for Independent Living's Emergency Preparedness Training for Professionals. Our webinar has been brought to us today by Services for Independent Living. My name is India Jones. I am the Community Services Manager here at Services for Independent Living, and I will be your webinar facilitator and presenter for today. So some of the main objectives of this whole training course is to give professionals and individuals guidance on how to work with the disability population when discussing emergency preparedness subject matter. Also to demonstrate the importance of making sure that consumers with disabilities are definitely included in their own emergency planning processes and thoughts. And to also provide professionals with the tools to assist in with their consumers or their patients or their family members with forming an emergency preparedness plan of their own that will assist with them having a safe evacuation, or if they have to stay in the house in the event of an emergency situation, just to make sure that they actually have those plans in place and they understand and know what they are. So what is emergency preparedness and why is it important? I want to say prior to COVID-19, with me living in northeastern Ohio, close to Cleveland, I never really experienced a real emergency situation until COVID. And, just trying to even go to neighborhood grocery stores and going to get the things we need, like toiletries, tissue, was very scarce. And so that really put me into overdrive with thinking like, wow, I really need to tap into what emergency preparedness is. Yes, we're not having hurricanes here and things of that nature, but, that was a state of an emergency. Too often, the needs of people with disabilities are just not considered in emergency planning. Emergency preparedness is a shared responsibility between you and your consumer, or you and your family, or you and your caregivers. So preparing for an emergency doesn't have to be complicated, expensive, scary, or stressful, but it does take some planning. Emergency management is a great concern in our disability community. There is a chance that your consumer or your family member or even yourself may not already have an emergency preparedness plan in place. This is where you come in as a professional. So if you do have consumers that you work with, talk to them about emergency preparedness. You'd be shocked to see that, maybe some people have not even dabbled or even thought about the subject before. I'm going to show a quick video I want you guys to watch, and then we will resume right after that. So basically, Benilda was unable to evacuate before or during Hurricane Katrina. Benilda told her friends that the water was rushing into her home just before her phone went dead. Her body and her wheelchair were found floating inside her home several days later. When you look at this situation, it's kind of confusing because Benilda made sure that she did have an emergency evacuation plan, right? I mean, they were supposed to come pick her up, but that fell through. So that just kind of puts us in this perspective of thinking like, hey, we have to have a plan on top of the emergency plan that we set. So a backup plan for that almost. As a professional, you can help your client prepare for emergencies. Think about Benny's situation. Since her original plan fell through, she had no way to evacuate out of her flooding apartment once her pre-organized plan canceled on her. Should she have been left to die? Of course not. This could be any one of our consumers, any one of our family members, or even one of us that could possibly be in a similar situation like this. Disability awareness helps to remove barriers, so that way responsible, self-sufficient people with disabilities can assume risks, make choices, and contribute as they wish. This is a vision in which we all win. As a professional, or like I said, even a family member, you can make a difference. You have a duty to protect and address health and safety issues with your consumers and your families. It is critical to educate and provide emergency preparedness training not only to people with disabilities, but also to their caregivers and their family members. Because what good is it if you educate an individual who has a disability, who relies on the assistance of a caregiver, but yet their caregiver is not included in the emergency plan? That's not really helpful for that individual. So let's talk about a few reasons why professionals should start including emergency preparedness in their practices. 1, the duty to protect and address health and safety issues. 2, it gives your consumers the tools they need to prepare for an emergency. 3, we live in a society where emergencies are prevalent. Like I said, here in northeastern Ohio, no, we're not having hurricanes and things of that nature. I think in Dayton, Ohio, where my husband's from, they actually experienced an earthquake last year that tore up a few of the apartment complexes, and that was really scary. And, think about that. A lot of people were not prepared for that. They should definitely include emergency preparedness in their practices to help stop the institutionalization of individuals with paralysis or some other form of a disability by implementing proper emergency planning. There's no reason why individuals that need extra help or who may have paralysis should automatically be institutionalized and not be allowed to live at home just because of the amount of care that they may need, or the family worrying about, we really don't want them to stay at home by themselves because we're not sure if they can get the help they need. They can get the help they need. And we need to start planning for those type of situations so that way we can keep people in their homes. So when you're doing an emergency preparedness kind of process with either your family or if you're the professional working with a client, you want to do an intake process. The best way to get an idea of what your consumer understands about emergencies and if they are prepared for one is to have them fill out an emergency preparedness intake form or some type of paperwork. If you guys look in the handout section, I did include an emergency prep booklet, an emergency contact list form, and an emergency plan checklist form. So please feel free to download those and utilize them for your own use or for a client or anything of that nature. You can complete the intake paperwork with your consumer or, with your family in person, virtually if it's more of a client kind of situation. I know that we're not completely over COVID yet, so that's why we're still doing virtual webinars here or even by phone. You want to be patient with whoever you're trying to do the intake paperwork with because you don't want them to feel rushed, okay? You want their responses to be as detailed as possible, and you want them to really think out what they're trying to say. The intake paperwork can consist of 4 parts. Here, we developed our own emergency preparedness paperwork and plan and training manual. So this may not be everywhere, but for here, the type of paperwork that we have that you also can download, we have it in 4 parts. Part A is an emergency preparedness questionnaire. Part B is just kind of identifying who their support team is, who is their support system, getting them thinking about, are there some individuals that they can actually rely on in the event of an emergency happening. Part C is the emergency plan checklist, and Part D is just them getting all of their important documentation together. Once you kind of go through those 4 parts, you can start kind of focusing on what does your kit look like? What does your client's kit, what are their needs? What should that look like for them? Because each one of us are individuals. So, of course, you know, what I may need in my kit may not be the same thing that you or your consumer or a family member of yours may need. So, you know, when you're helping them to create these kits, you want to think about, you know, consider creating maybe 2. So one could be a evacuation kit. And make sure it's lightweight. It doesn't have to be really huge or anything like that. But in the event that something happens in their home, like they have a terrible snowstorm or a rainstorm rather, and all the electricity is out, they don't have a generator or anything, and they need to get out of there, make sure that they pack a little something that they can easily take with them in the event that this happens. So it can be by the door, a door that is close to an exit in their house, and they can use that to evacuate. And then they also will need something that they can utilize inside the home. If they get snowed in or something terrible happens and they have to spend 2 or 3 days inside the home without being able to get out, they should be able to have a supply of everything that they need to stay directly where they are and support themselves for that 3 to 5 day period. So what are some supplies that we can think of right off the bat that people may need? Of course, we're going to need water. 1 gallon of water per person is what we usually recommend. A 3 to 5 day supply of non-perishable food items, a week's supply of medications and medical supplies, at least a flashlight, one flashlight at least, and batteries. Don't forget batteries. If they're going to have to leave, they want to make sure, and if it is cold weather, because, you know, here in Ohio, it gets pretty cold at times. You want to make sure that they have warm coats, gloves, or mittens, hats, boots, blankets, you know, easily at their reach. With COVID going on, face masks and protective items to cover up open wounds as well. Battery-powered or hand-cranked radios, because if you're without electricity, you won't be able to plug those type of devices in. If you have to think about an infant, you want to make sure you have a little stash and supplies available for them in the event that there's an emergency. So that will consist of their formula, diapers. If you use incontinence supplies, you want to make sure you have some of those. Let's not forget about our wonderful pets. You know, we want to make sure that we have a little something set aside for our pets. Cash, coins, credit cards, you want to make sure you do have access to these things and make sure that they are low denomination. Everyone is probably familiar with the first aid kit, so I won't go over everything that's in a first aid kit, but you can buy a basic first aid kit from your local Family Dollar. You want to make sure you have one because you never know when you're going to need it. Let's think about if we are, for some reason, in our vehicle, it's a terrible snowstorm or something, and we actually can't get out of the car and we can't get to another location at that time. In your car, you want to make sure that you have these items. These are very important. To this day, here in northeastern Ohio, I always keep some rock salt and things like that and a shovel in my trunk because I've gotten stuck before. And, you know, it really helped me get out of a ditch of a whole bunch of snow. So you want to make sure that you have something of that nature, even sand. So that way you can put that traction down and it can help your tires kind of get out of that section that you're stuck in. Bring a paper and a pencil or a pen, books and games and activities. So that way if you are stuck in a car with children, you can give them some activities to do to kind of take their mind off of the emergency. Jumper cables, of course. Nowadays, they actually have the boxes that you don't need another vehicle to jump your car the box can do it on its own. So that's a really good investment. I always tell people, if you have an older vehicle, it's nothing wrong with actually, buying one. Flares are reflective triangles. What if you get stuck on a road and it's not a lot of lighting? It's good to have that so that people can see that you're right there, or you can kind of wave them and call for help. Gas. Oh my God, that is so important. I can't tell you how many times I've actually, my sister or even myself, we've run out of gas, and it wasn't even a bad weather situation. It just was lack of paying attention. So, try to have a gas can in the car just in case, because you never know. Now, yeah, it's 2021, about to be 2022. Maybe some people can call roadside assistance. Maybe some people have AAA, but hey, some people don't have those things. So if you can kind of think ahead and be a little bit more self-sufficient with making sure you have these things, then, you could be good to go on your own as well. Again, there's that first aid kit, gloves, just in case you may need those, non-perishable food, and bottled water. What else may your consumer need during an emergency situation, or even yourself? You got to think about transportation, right? Like, how would they get from one place to another if they really need to? If a person's in a wheelchair, like Benilda, she needs to make plans to be able to get out of her house and get transported somewhere else. So who would be her transportation source? Adaptive equipment. Is there any adaptive equipment that you use or your consumer uses? Medications. You have to think about that too. A lot of times, a lot of our consumers have said to us, well, India, my doctor doesn't give me enough prescriptions for me to have extra to put aside to put in an emergency kit. Totally understandable. And a lot of us don't have a lot of funds to try to buy extra, and we may not even be given a prescription to get extra. So my main recommendation would be, a lot of us are familiar with the pill organizers. Try to have that readily filled, so that way in the event of an emergency, you can grab it and go, or you can always keep something in the bag with you, just like an EpiPen. If you need an EpiPen, make sure you have that on you. Is there any durable medical equipment? What type of help from another individual that a person may need to maybe even just transfer out of a wheelchair or a bed? Is there any assistive technology that they need? Are there any other medical or health needs that, need to be brought up and thought about to include in their emergency preparedness, evacuation plans, or shut-in plans? So these are all things that we all need to think about, whether we're talking about these things with the consumer or our family, or just, doing this for ourselves. Like you saw in the video, Benilda had a plan. She had a plan A, but plan A did not pan out. And unfortunately, there was not enough time or a plan B, created. So in the result, she lost her life, and it should not have ever been that way. And that's terrible. The information that you're going to gather from thinking about all the things we talked about in the previous slide and in the intake paperwork will help you or your consumer create their emergency plan. As professionals, we want to make sure that persons with disabilities are aware of emergency procedures, that our consumers have an emergency plan in place, that they understand that they may need to double up on their supportive devices, that they need to be prepared to evacuate during a fire or other emergencies, that they need to have a plan to prompt response to medical emergencies, that they are aware of what shelter in place means and where there are some safety locations in their area. That's very important too. So in that video, Benilda was supposed to be taped to the Superdome. Here in Cleveland, depending on where you live at, Euclid, Shaker, we need to be aware of what are some safety locations. And I don't think that they really talk about that enough in our communities. So that's something that we all need to make sure that we kind of seek out and we learn more about. We want to have prepared important messages that are legible and proactive shields. We want to have general information and phone numbers readily available. So nowadays, we all use cell phones, and we know that, which can kind of hinder us, right? Because I can tell you right now, I do not know my mother's cell phone by heart number, and that's kind of bad, because any event that my cell phone dies, how will I reach her? So it's important to also go back to the old way of things and still have a list of numbers somewhere typed up or written down that you include in your emergency kit. Okay. Here's some questions that you can kind of bring up to your consumer or your family members to kind of get them thinking about this kind of subject more. Ask them, what does your emergency evacuation consist of? Who do you call in the event of an emergency? And when I say an emergency, yes, your first thought is 911. But if it's something like, okay, well, I don't want to call, it's a non-medical emergency, and you want to just be able to pick up the phone and call someone close to you, do you have that plan in place already? Have you talked to that person and acknowledged with them, hey, in any event that I need something, is it okay that I call you? You need to talk that out with the person. Make sure that they have the lockbox code to get in your house or know where there's access to a key. Do you have an emergency to-go bag ready? Have you practiced an emergency evacuation just to, run through it, just to practice? So these are the type of questions that will help form a baseline to go from, that will assist you in helping your consumers to form their emergency plan, or for you or your family to form your own. Here are a couple of tips that you can give for yourself or your consumer while assisting them in creating their emergency plan. You want to, let them know that it's important to create a support network in the event of an emergency. They want to tell people in their support network where to find emergency supplies. Give one support network person that they trust a key, or like I said, the lockbox code or something of that nature, so that way they can be able to gain entry to their house. Create an ICE card in case of an emergency. That's an info list to let others know whom to call if they find you or your consumer unconscious, if they're unable to speak, or if they need help to, get out the house. You want to include any medical information about the person or yourself on that ICE card, and along with the medical providers that they usually go to, with the names of the medications they take, that person may take, or if you take medications. You want to include all this stuff because it's very important, the dosages and how often they take their meds. You want to list the condition for which they take a medication for, the name of the doctors who prescribe it, the doctor's phone number, primary location and phone numbers, and you want to keep the records of all adaptive equipment they use, allergies, sensitivities, and communication or cognitive difficulties that they may have. Attach all of these copies all together. And a lot of our consumers, they use a little container that is waterproof, that they keep this type of stuff in. So I would recommend you guys do the same. You want to maintain several copies of the emergency plan. Keep the copies of the emergency supply kit or the go-to bag in the car or the wallet or the wheelchair. Wherever you have your kit, you want to keep these papers in there as well. Keep at least a 7-day supply of essential medications, like I spoke to you guys about. If you're not able to get additional medication, which a lot of people are not, just have your pills in a pill organizer, something quick so you can kind of grab them. They won't get unorganized and things of that nature. You want to keep if you have a service animal, that's so important. Our service animals and our regular animals are a part of our family. So you want to include them in your emergency plans. You want to make sure that they are going to be safe. They're going to have a safe place in the home if something happens in a home, or if you have to evacuate, that you can actually take them with you if you have to go to a shelter. Some of the complaints that we've got before from consumers is that the local shelters here, they really don't honor that, hey, I have my animal, my service animal with me, and some people cannot get around without that service animal. And, a lot of these different places here, they just are not equipped or even knowledgeable, it seems like, about the importance of, being able to bring your pet or your service animal with you to the shelter. So that's one of the things that we here at Services for Independent Living, we really want to start advocating for, making sure that these organizations that say that they're here to help, that they understand the importance of helping an individual that may identify with a disability. You want to have extra food, water, and supplies for your service animal or pet as well. So how should your consumer develop their support network? This is a big question because what if you're a person who moved to a new city years ago and something happened and now you do need more assistance, whether it's age related, an accident, or what have you, and you don't have anybody here in the city. Your consumer will need to try to sit and think and make a list of individuals that they think that they can count on in the event that something happens. Help them identify who these people are. Inform them that they will need to contact these individuals to make sure that they are able to help. They want to make sure that they actually meet with their support network occasionally. So, for example, we have a consumer. She's not from here. She moved here, but she does have a great support network system with her caregivers that they have been helping out with her for about 4 years now. So she actually took all of these steps. She met with them. She made sure that she made them aware of her emergency plans. And, for her, that works. So each one of us will have a different situation, of course. But that, just to give you an example, that really worked out well for her. Your consumer will need to make sure that they teach these individuals how to assist them and how their devices operate. I cannot say how important that is. If you have someone running over to help you, but they don't know how to properly charge your wheelchair or to how to even turn it on, how can they get it to the side of the bed to help you get out? So keep that in mind. It's very important to teach these people that you're going to have in your support network how to use your devices. Your consumer's emergency plan or your emergency plan or your family member's emergency plan need to be tailored specifically to their needs, okay? So you want to assist them in developing that, and that is a three-part process that we kind of figured out here. So you have communications and reunification, evacuation, and shelter in place. So all three of these things are topics that you want to discuss with them and help them develop. Let's talk a little bit about the communications and reunification plan. So consumers should keep a battery-operated charger in case, like I said before, a lot of us, depend on these cell phones and stuff, but if we're without electricity and they die, we have to have another way to charge things. These days, there's all types of little new devices that they made that, can charge your battery in your phone without electricity, so that's awesome too. In case of a power outage, along with whistles, horns, or anything else that can create loud sounds, you want to make sure that they have that. Accessibility, you want to make sure that the program contacts in their phone that they're using, for example, say your consumer wants to reach out to somebody in a fast time frame and not try to find their name in the phone. Program it in the phone as if they press number 1, that will automatically contact that individual. So say I wanted to contact my mom, it's an emergency, I can just press number 1 on my phone, and my phone is programmed to where it'll call my mom right away. So little things like that make a huge difference during an emergency. A meeting place. There should be a designated meeting place that has been chosen ahead of time that will be the meeting place in the event that an emergency situation happens. So previously, when we used to be in different situations where they did drills, like fire drills, or if they did tornado drill, there always was a designated agreed place that everyone was to meet up. And so that's the type of thought process you need to keep moving forward as well. An evacuation plan. We need to know where the local shelter is and how to identify the steps that will need to be taken to be able to stay there if indeed, for some reason a person has to get out of their home or their home caught on fire. They can't stay there, of course. So they need to know what their evacuation plan is going to look like and what are their options. If your consumer has a car, suggest that they keep a full tank of gas. I can't say how important that is again. That is very important. They need to know, will a friend or a caregiver or a family member be their designated ride? What if they don't have a car and they need to get out? Will they have to depend on an outside source? What are some outside sources? Of course, nowadays we have like Uber and Lyft and things of that nature. So, those are other options as well if you don't have a designated ride. What form of transportation will they need? For example, a vehicle with a wheelchair lift and an ambulance or an ambulette, depending on their needs and how they actually transport. So all of these are very important tips to think about when you're helping somebody think about their evacuation plan. You need to explain to your consumer when you are talking about sheltering in place that there will be times when certain emergencies will happen and they will need to stay put right where they are. There's been plenty of times here in Northeastern Ohio we've been snowed in over the years. You really just could not get anywhere. This is considered sheltering in place. If this happens, they should already be prepared with their sheltering in place kit. They should immediately bring any pets inside and contact family and other supportive team members to let everyone know that they're safe and that they are in the home. These are just a few tips that could be important when sheltering in place. They want to find a safe place in the house, choose a room in advance. They have everything already set up. Make sure all windows are closed and exterior doors. You can even hang a shelter-in-place sign outside the door to help response teams quickly find your location and know that, yes, someone is in this house and we're sheltering in place. You can also call 911 and notify the emergency response team of your whereabouts and that you're safe, but you are, in your home. You want to turn off fans and heating and air conditioning systems. You want to keep your disaster supplies kit and your to-go bag and a working radio readily near or available, because guess what? If you do have assistance that comes to help you, you want to have that to-go bag ready, because like we talked about before, your important papers should be in there, your medications, so you want to have those things ready. You can use duct tape and plastic sheeting to seal all cracks and vents in the room, and that's just for different situations. Of course, you won't do this for a snowstorm. And then you want to keep listening to your radio or television or local officials so that way you can get more updates on whatever's going on weather-wise, if it is weather-related. So depending on where you live or where your consumer lives, the type of disasters and emergency situations can definitely vary. You want to research with your family or your client, or you do your own research on what are the disasters that are prone to your area. Like I said before, such hazards can include hurricanes, but maybe not here where I am. Power outages definitely can happen anywhere. Severe winter storms, depending on where you're at, extreme heat, tornadoes, or things of that nature can be some of the hazards that can happen, just depending on your location. So let's talk about some common miscues that we've run into when talking about emergency preparedness here with our consumers. A lot of people think that separating the service animals from their owners is not a big deal. Definitely a big deal. Not allowing evacuation chairs in hallways. Not involving the disability community in the planning processes. That's a big no-no. If I'm trying to figure out something for myself, I definitely won't say so. So an individual who is not in my shoes and who may not have the same disability or identify with the same disability that I have should not be in charge of, making a plan for what my evacuation plan should look like or my emergency shut-in plan should look like. Whether individuals with disabilities should evacuate immediately or wait for first emergency responders. That's always been a big question too. But I would say, just from experience, do as much as you can to, plan, because as you saw in that video, she did rely on emergency responders, but they did not come get her. So we have to take things into our own hands when we're dealing with our own lives and, kind of step up and plan for ourselves as well. And then the other thing is just not recognizing non-obvious invisible disabilities. A lot of people are under the impression that just because they can't see that a person has some type of disability, that there's nothing wrong with them or they don't need any help. So those are all things that people need to just stop assuming, because they're wrong. What is personal preparedness? This is a good one right here. So it's all about your consumer pretty much recognizing that they have a disability and that they will need additional attention and assistance, okay? So it's kind of like them coming to terms with that, and then that they have their critical information ready, because that's really important with them needing the extra help. their support teams, family members, or whoever, whatever emergency planners they put in place, they need to be aware of what exactly their needs are, so that way that they can help them in an emergency situation. Personal preparedness is also about establishing a support network, just making sure that you know who are going to be your go-to people, who are going to be your plan A and plan Bs if you're able to do that. And it's also important that they have their personal needs ready to go in the event that they have to evacuate. The best thing to do is to give your consumer or your family members resources. Make sure that all information that you provide to your consumer are available in all accessible formats, such as Braille, large print, audio, disc, closed caption materials, things of that nature. We deal with a lot of individuals here because we service Lake, Geauga, and Cuyahoga County. So, we always want to make sure that whatever information that we do have here, that we do have it in different forms as well in case someone needs it. The following resources should be based in the area that your consumer or you or your family member lives at. So they need to know about the Department of Senior and Adult Services, the Office of Emergency Management in their area, Office of Homeless Services, of course, their Sheriff's Department number, the Witness Victim Service Center, emergency shelter list. They need to know where are these shelters located in their area. And of course, United Way can be called from any phone. It's just 211, and they can really provide a lot of resources in a moment of seconds for you. So 211 is always a great go-to as well. Let's talk about emotional and mental health with this too. Emergencies can cause you, your family, or a consumer to develop fears and even anxiety. Talk about emotional issues with sheltering in place. Recommend different activities that your consumer can do with their time to help ease their anxiety if they are in a situation where they have to be shut into the house, for a while, or if they are stuck in a car for a few, think of some activities that can, take their mind off of the stress. Let them know that the feelings that they have about emergencies or even developing an emergency plan are normal. We have consumers here that felt overwhelmed, when trying to think about how they were going to put together their emergency plan. And we helped them with that, but we also took our time. We didn't make it a one-day process because everyone's different. Very important to always have a backup plan for the plan. I can't say that enough. I know I've said this about 3 times, and it's repetitive now, but it's so important. After you assist your consumer in formulating their emergency preparedness plan, they will still need to have some kind of backup plan for that plan. So let's just look at a few scenarios. What if you, or we'll say your consumer, must relocate, but will still need their routinely home health care services? Will they be relocating in the same area, county, or state? Will their home health, mental health, and other services transfer with them? If they are forced to move out of state, what happens to your consumers' benefits, like their Medicaid? So these are things to always really, really, really focus on, because these are huge questions. Okay, so if I do have to relocate, will my caregiver be able to come wherever I'm going? If I got to go to a different state or county, can I use the Medicaid there? So these are things that they want to look and seek out the questions and answers to ahead of time. So that way they are aware of, if this happens to them, they know what to do and how to go about taking care of their business in another, area. Ever since Paula had her second stroke, a PCA, and for those who may not know what a PCA is, that's like a patient care assistant or a home health aide, that sort of thing, has been coming to her home to assist her with her activities of daily living. Due to a severe snowstorm, her PCA will not be able to travel safely to her. What should Paula have in place for when this type of situation occurs? Her plan B, right? So maybe a family member or someone she trusts that may live a little closer, that may be able to get to her. Because a lot of times when things happen, I want to say when COVID happened, we got a lot of phone calls here that a lot of consumers were without their home health aides and PCA technicians, because people were calling off out of fear of COVID and just fear of, catching it or passing it on to the consumers. So, they were without care. So a lot of them were even calling here asking to see if we knew of any other type of assistance. So it's very important to have a plan B for this type of situation as well. And another scenario here, a terrible snowstorm has hit town and causes a power outage. Paul is a paraplegic and he uses an electrical wheelchair to get around. The battery on his chair is going to die soon. What are some preparations that Paul could have made ahead of time that would have helped him out in this situation? A lot of our consumers who are in electrical wheelchairs, they have a second battery, and they always have one battery charging and one on the actual wheelchair. So in the event that the electricity goes out, they need to have another battery charged somewhere so that way it can just be switched out. And with COVID-19, oh my gosh, I'm so tired of talking about COVID-19, but honestly, it still has not gone away all the way. So, many people with developmental disabilities have lost access to caregivers and service providers, and these supports may not return given the financial toll of how the pandemic, hit us. There's still a lot of agencies that are really struggling with getting caregivers back, and it's crazy. So having strong support systems in place can help individuals who are currently experiencing these type of issues. When you think back to COVID-19, none of us was prepared. Again, disability lives lost ranked at the top. If you ever paid attention to that, I don't know if you guys are paying attention to that, but we definitely were paying attention to the ranks and the statistics here, and it was just crazy. Congregate care was not considered in planning. Personal protective equipment needs caught everyone off guard. It was really, really scarce. We really couldn't get, the same things that you would get walking into the store any other time. Shelter in place took on a whole new meaning. A lot of us were just shut in the house, and it was just crazy. And a lot of us were missing going places, missing seeing other people. Food supplies, delivery, and assistance now on agenda were like skyrocketing. So you saw people, utilizing Amazon delivery and Walmart grocery delivery and things like that even more because of the fear of going out. Medical services and hospitals were just overpopulated and the staff were burnt out. Developmental disability services experienced interruptions and challenges. A lot of clients were not getting their routinely programs and stuff carried out because everybody was scared to travel. And so we kind of adapted to a more virtual aspect, right? Which is why here at Services for Independent Living, we've been doing a lot of webinars virtually, which has worked out. We still get to interact and kind of educate the community on different things. Let's talk about the burnout. Caregivers and family members may become burnt out during emergency situations and, emergencies that may last longer than they expected. So what are some things that you or a consumer could do to kind of alleviate some of the stress off of the caregivers or whoever may be assisting and helping? Create a buddy system. Like I said, never rely on just one person. So that way people can kind of switch off, and to help you with different tasks. Encourage your consumers to do as much as they can for themselves. That's very important. A lot of our consumers, they're all about doing the most that they can for themselves. So we've never really had to have that conversation with anybody. But if you are talking to a consumer or a family member, get them kind of thinking about some of the things that they can definitely do for themselves and make sure that they're continuously doing those. So that way the stress or the pressure, can be a little bit lighter. Be gentle and have patience with each other. I can't tell you how many times that people can get frustrated, angry, or just, emotional during emergencies. So it's very important to be kind to one another, be gentle, have patience. Everybody gets under stress. So you just want to make sure that if you are the person that needs additional help and you need caregivers and family members, that you are being patient with them and, just understanding that it's kind of hard on everybody. And you also want to let them know that it's important to connect with their local area agencies for different tips or resources that they can use during an emergency. I just left this up here because I really liked this little quote. I thought that it was touching, so I did include this. I hope that you guys look in the handout section and download what we have there, because they're very, very useful resources, and you can even fill them out for yourself and have them in a waterproof container for all your important paperwork. Or if you have to, have some type of situation where you need to leave really quick or whatever. So I hope that today you guys got a better look at, why it's important to kind of plan for emergencies if you weren't thinking about that already. In 2022, we will be having an emergency preparedness focus group where we're going to include some of our local medical and emergency responding officials. So that way we can kind of have a platform to talk with them and give them a greater understanding of how people with disabilities really need to be included in emergency planning. Here are just some different resources that, if you guys are not already familiar with, are good websites and places to go check out information for emergency preparedness. After this webinar, there will be a satisfaction survey that's going to pop up. There is a question on there asking if you would like to be a part of that emergency preparedness group that we're going to be having in 2022. I can't believe 2021 is over, you guys, already. It's crazy. So please feel free to click yes on that question, and so we will be in contact with you to make sure that you get an invite for those meetings. And it will be really helpful. So that way our local officials can really hear from individuals who may identify with having a disability, or who have clients who have disabilities. So that way we can advocate for better emergency response techniques for individuals with disabilities. I want to thank everybody for coming today. And please fill out that survey so that way I can get in contact with you and include you for that group. And please stay safe, COVID-free, and I hope to see you on our couple of webinars that we have coming up for December. It's so crazy, this year is over. Everybody take care, and thank you for attending today.